syndrome is a genetic disorder characterized by tall stature, long arm span, high arched palate, arachnodactyly, and bilateral superotemporal lens subluxation. Surgery is indicated when the amount of subluxation increases, leading to disturbing diplopia and increased or changing refractive error. We present a case of 29-year-old lady, diagnosed case of Marfan syndrome, presented with complaint of gradual progressive diminution of vision in both eyes since 2 years, with best corrected visual acuity of 6/36 in both eyes with -15 dioptric sphere correction. Slit lamp examination showed superotemporal subluxation of clear lens in both eyes, and the patient was advised lens removal with Sione ring fixation in both eyes, and patient was taken up for surgery. During the surgery, the gentle capsular excess was done. Iris hooks were placed to stretch and stabilize the bag. Gentle phacoemulsification was done, keeping low flow rate and low vacuum so as to avoid undue stress on the weakened zonules. Side port entry was made to facilitate the irrigation and aspiration process. A gentle irrigation and aspiration was done, keeping in mind to avoid any stress on the weakened zonules. Cortical remnants were aspirated very carefully and the iris hooks were removed. Pre-placed corneoscleral tunnel was checked. The needle insertion was done by railroad technique and threaded to the eyelet of Sione's ring. Sione's ring was inserted and dialed into the bag using the trailing eyelet. Threads were pulled out from under the corneoscleral tunnel and the knots were buried inside. The IOL insertion was done into the bag, and the result is a well-centralized, stable intraocular lens. In this case, Since the amount of subluxation was more than 180 degrees, we decided to use a Seone ring, which helped us place a well-centered lens. We operated the other eye of the patient also, and now our patient has visual acuity of 6 by 6 with -1 dioptric sphere correction in both the eyes.